So today, really simple. Kath wants to give a very brief reminder, I think we call it, rather than introduction. Very brief reminder of the work that's been going on and the challenges. But then we'd like to give you lots of opportunity. That comes up on number 3 and 4. Lots of opportunity to talk through a particular challenge you've got and have some airtime, which could be as much as 10 or 15 minutes, just to talk through anything you're finding challenging and how the rest of us could support you on that. And then at the very end, just for no more than about 5 or 6 minutes, Kath will summarise and we'll talk about any next steps about joining up with others who might have taken part in the carers events as well, which I guess is where you will have met Kath before. So very briefly, Jane and Nick, before I pass over to Kath, would you mind just telling us and each other what your work is? Just very brief, just an introduction. Who's going first?
I don't mind. Do you want me to go first, Jane, or would you prefer?
Go on then. You volunteered.
Okay.
Nick.
Yeah, my name's Nick Taylor. I'm the founder of an organisation called Care Advisor Network, which is a not-for-profit organisation, and we support professionals to provide care advice. We started more recently a Care Navigators programme, and which is why I sort of came along to the event in Swindon, met Kath. Afterwards, and actually it's snowballing faster than I'd ever envisaged. We want to sort of pull all the strands of information and advice together and support not just professionals to help people get the right advice at the right time, but also to help people arrange their care. We don't provide hands-on care. We provide information, advice, and support around information and advice. But the Care Navigators service provides care planners and initial sort of free telephone conversation around personalised care and care funding to individuals, and it's that part of it that is taking off, getting stronger and stronger really at the moment. So we're trying to build into the training element a much stronger carer flavour. And the one thing that I picked up from the recent event in Swindon was that was missing, and I'm ashamed to say. So we're addressing that and have addressed certainly the training aspect of it to be much more inclusive, carers.
Yeah, thank you, Nick. We'll talk more in a moment. That's really helpful. Thank you. And just one question from me before we pass on to Jane for a quick intro, is where do you get your, if you call them referrals, where do they come from mostly?
At the moment we have professional members, so largely the referrals are specialist care cases or benefit cases, and they come from solicitors, financial advisors, and accountants.
I see.
Largely.
Yeah.
But the Care Navigator is more consumer facing, and we're making headway with CCGs with the hospitals. We're now working with 4 different hospitals. Certainly they've taken the care planners on and so on, and we're going into the discharge meetings and helping them with their self-funders with information advice. So it's different aspects really of the work.
Yeah, interesting. Thank you, Nick. We'll talk more, surely. Thank you. Jane, do you mind just doing, I think I've taken you off mute. Yeah, a quick...
Yeah. Okay, hi everybody. My name's Jane Isaac. I'm a practice manager in Bath. Excuse me. I came along to the Swindon meeting because I have a personal interest in caring, because I think I care for my Uncle John, who's just going into the dementia spectrum. So, and a brand new practice manager started in end of June and wanted to also sign up for dementia and everything else. So I sent Martin an email.
You did. I quickly read it out to Kath, but you didn't. I didn't get a chance to type it out. Okay. So yeah, thank you, Jane.
So yeah.
So a practice manager, and where would you say you are in you say you're new, actually, but within the kind of spectrum of practice managers do you feel like you're doing more advanced work around carers, or?
Yes, I think so, actually.
You are, yeah.
Yeah.
You're beyond the average, yeah.
Yeah, I'm going to sign up to be Dementia Friends as well as an organisation. The thing is with GP surgeries is they're individual businesses, and so anything we do has to be funded, basically. So there's a fine line between how much time you can put in for free and how much time you should be working for the partnership.
Yeah. Thank you, Jane. Thank you. Now, just make sure I haven't got somebody else on the call nobody else? No? I've got a mystery name come up on, but it's nobody's name. That's all right. So I'm going to go back to Kath. Hi, Kath.
Hi.
Would you like to do your introduction, if I can get the right slides? There we are. Do you want me to pass it over to you so you can click and run it yourself? I'll do that.
Okay. So I just do it on my keyboard, do I?
Yes, yeah. At the top, you'll see a little slide number. Over to you, Kath.
Thank you. Hi. Thanks, Jane and Nick, for joining. So, and this is the first, and then we'll have another one this week as well, and then we will hopefully make good use. I've gone very crackly. Am I hearing it? Sound okay?
Yeah, we're finding.
Yeah, sound good to me. Yeah.
So just to recap a little bit on what we've been up to and where we're going. As we know from our meeting in Swindon, which is one of the 3 events, we had the second event in Taunton, and we've got our final South Eastern Wessex event in London at the end of January. We've got awareness of what the challenge is to us all in terms of developing an integrated approach to identifying and assessing carer health and wellbeing, and we're all familiar with the 3 bullet points shown below in terms of what that identifying and assessing carer health and wellbeing is all about: independence, empowerment, shared understanding. So there are those sort of common goals I think we all share. So we're clear with what our challenge is. We're clear with what our tools are, I think, now as well. We have the mandate to set out from the Care Act. We have the Carers Toolkit now as a sort of a tangible, hopefully, resource that we can actually be meeting between health and social care to be saying, okay, can we confidently say that we are looking at the 7 principles and that we are looking at how the Memorandum of Understanding can facilitate change and improvement in planning care services. We've got opportunity through CCG assurance frameworks, and I've been involved recently with CCG planning for next year, and I've been writing in big bold letters across many plans where our carer priorities, and ensuring that actually we do need assurance that there is recognition of carers' needs, and whilst there's good recognition of saying patient involvement, patient engagement, actually I'd like to be seeing patient and carer as a sort of synonymous term, really. Sequins, I mean, that's relevant, I think, in part in places, and one example of successful sequin, I guess, just to explain, I can't actually know if I can remember what sequin stands for, but sequins are targets that are put into place and are financially driven to encourage healthcare providers to be ensuring that elements of care cover certain target areas. So they're quality indicators, essentially. And an example of a sequin linked to carer work, actually, is with John's campaign, whereby that is a sequin now, I believe, in hospitals that have signed up to John's campaign, which means that that hospital has to show that for carers there are no visiting hours, there are no restricted visiting hours, and that carers can see their loved one at any time that can suit, and that's for the benefit of the patient and the carer. Really importantly, I think, peer comparison, it's about this opportunity to have things like this so that we can be sharing good practice. And I know Fiona was, with her information she sent through to Martin about ideas for today, it's very much about how can we share best practice, and I'm starting to think about how we map that and keep that coming back out to all of you so that you've got constant resources and ideas and tools to keep your work moving forward. And Jane, you've got lots to share as well in terms of what you're doing, which I'd love to add into this map. So what we want to be able to do is put these principles into action through cooperation, through understanding what we mean by well-being and being consistent in that approach, and ensuring that we are having that sort of whole family approach, which would ultimately help to reduce health inequalities. I don't know where the slides are. The principles. I've run out of slides. I'm not sure. We did have a slide which actually just listed the 7 principles.
I think you'll find it on the. If you look in the top tabs, you'll see next to what you'll see another one called Caring Together.
Martin, so clever.
There you go.
And the 7 principles. So just to remind us of the 7 principles, and it's interesting because some feedback I've been getting from across South Central mainly actually, people are coming back to me and talking to me in the context of the 7 principles, and I think they are very good benchmarks that we can be actually gauging advanced and sort of areas of development and examples of good practice that we can then try and share. So I think as principles they've definitely got life in them, and it will be exciting to see what we can move forward with next year, I think as well. So that was really the sort of scene setting.
Okay, well, I'll take myself off mute as well. So thanks, Kath. So we've got pretty much half an hour and a bit. And it's great that, in a way, I think there's just the two of yourself, Jane and Nick, with us. It gives you lots of time, I think, for a bit of problem solving, if that's what would be useful. It doesn't have to be quite as formal sounding as that. But if you would like to present in a very informal way the next challenge, whether it's one of the principles or much more practical than that, it'd be good to give yourself a bit of time. We could talk through it in a positive way. Does that sound useful? Oh, I've taken you off mute. I will take you off mute.
Yeah, it does. I'll just try and type something, but perhaps I'll just say to you, I think what we did and what I've done in my own GP surgery for my Uncle John, I've then emulated in my GP surgery. So we've written all to the carers saying, with a consent form, saying would they allow their mobile number to be put onto the person who they're caring for's clinical records, because what we're finding is, especially with people with dementia, the carers, you won't necessarily they DNA a lot on their appointments, and so that's they waste GP time and money, and also clinical care for the patient. So by me having my mobile number on my Uncle John's clinical record, I get a mobile reminder when his appointment is due, 24 hours. Then I'm chasing him and I'm ringing him and I'm just reminding him so that he doesn't DNA on that blood appointment or whatever he's doing. And so we've done the same in the surgery here in Bath, is we've written to all our carers, and it just will save the GP time but also help the patient and the carer.
That's really interesting. There's a couple of things really interesting there, Jane. One is that you've done something very practical, but it's based on your own experience. And I think that's, when I was talking to Kath just before we started, and I read your email out to her. I think that's, it's a very profound way of working, is to use our own personal experience, and you've already talked about your uncle there, to inform the way we work at work, and why shouldn't we? And I think that, I'm very impressed with that. And as a practical kind of improvement, sounds great. Have you? I'm just thinking about my father's role as my mother's carer before she died last year, and the same thing would have been really useful. Have you had a good response, or do you need to push people a bit to get phone numbers?
Well, we've sent the letters out, so we're waiting. I've had a few clients that have actual patients that have filled the format, and that's fine. Where people care for each other in the same home, it's not really a problem, because normally they're coordinating that approach.
Yes,
it's just that I have an arm's length care for my uncle. I pop in once a week at the moment. Obviously, it would change as he gets worse, and so, but he was missing appointments. So, and that was my pragmatic way of trying to sort it out. And the GPs here were keen to stop the DNAs, because GP appointment time and lost appointment slots cost money and also time for patients. So it's a win-win. And provided you can do a win-win for GP surgeries as well as the patients, then it's a very proactive approach, really.
Yes, yeah.
I'd like to ask Jane, if I may, given the Care Navigators aspect of our work, we have independent partners of the network who provide those Care Navigator services. So we have some who will, if you like, be support brokers. They will plan and arrange care for people. We may have financial advisors. We have solicitors, as I've said. We'll have people who go and fill in forms and so on. Now, I went with a partner yesterday, taking on board this carer strategy and the fact that we'd really missed this, and it was, as I say, I was ashamed of it. We went to a GP surgery to look at how we could help the partners, help GP surgeries to put in place a carer register and a carer support group, a regular carer support group, if they hadn't already got one, or if they hadn't got one from the voluntary sector, i.e. a local carers group. And I think one of the things that would have been really helpful for this surgery yesterday was, because I was met with blank looks, and it was a presentation that I can't remember the gentleman's name, GP did a presentation at the Swindon event. It was absolutely brilliant. And he'd addressed exactly that, as you have, Jane, in your surgery. And I wanted to encourage the surgery local to our partner to create a register, to create a carers register, and then to contact those potential carers and how, and then offer them the support and, the different speakers coming in. And because the partner was quite prepared to coordinate those meetings and host the meetings and provide the tea and biscuits, but they needed a room within the surgery to be able to do that. Yeah. And when I went to follow up this morning with that, I thought, when I looked at the presentation that I can't remember the gentleman's name now. I looked at his presentation, but it was really good. But actually, what I would like is a document or a PowerPoint or something that I could actually send to the partners of the network, so that they can go along to their GPs if they were looking at helping to coordinate a carers group with the GP surgery, to help them set up a carers register, to help them do what you've done, Jane, to help them do what the gentleman did in Swindon, which was set up a register if they haven't got one, and then provide those regular meetings, those regular support groups, to have different speakers in and to give them somewhere to go to voice those queries, concerns, to raise questions and so on. So it would be a kind of a process map, if you like, for creating and developing and maintaining a carer register.
I think that the GP surgeries in Baines, which is where I'm from, have all got carers registers, and that was one of the things they had to put in place for part of their funding from CCG. However, I think that the next steps, what we have done is I've invited the carers association in Baines to come to our next PPG meeting, which is a patient participation meeting.
Right.
Because there are some carers in there, but they're just, well, they're not just, they're our patients. So, and he's going to come along to that and talk about it. But it's quite difficult. Once you've got your list, it's about how much time and energy you have and the financial support to be able to do all of this stuff.
And I think that's where the partners of the network could be really helpful and useful to you, because of course they would be volunteering their time and as coordinators and build, they could help to build a regular carer support group and maybe even host that and get different speakers in each month. I went to one recently, I was saying to Kath, in Buckinghamshire, and they have the voluntary sector that comes in and hosts that meeting, which is great. But the partners of the network, it's something that they would certainly be interested in doing. So it's interesting to know that many of the GP or the GP surgeries have got to have a carers register for for the CCG in your area. I know the lady that I spoke to yesterday said that the CQC had been in to see them, and essentially said, from what I could gather, organise your information better, because it's there, but it's in no real order, and it's a bit kind of hit and miss. And she was very, very keen to set up a carer group. So that's certainly something that our partners could probably help the surgeries with, because they would be donating their time and their own resources for nothing.
Yeah, I think that one of the problems with that, sorry Martin, is that some of our carers look after somebody 24/7 and they cannot get out of the house because they are caring. And so if we're going to do any meetings, it would be good, as Martin suggested, to tape through an iPad or the pod thing, so that people can have a look at the webinar afterwards and then hopefully contribute that way, because that would allow them to sit in the comfort of their home and join into a meeting. So those sorts of facilities would be
Can I just pick a couple of things out there and ask Kath to come in as well? So that's really interesting, Nick. And I think the last thing we've just been talking about is access and accessibility, and making sure we're not discriminatory to the housebound carer. And that's really important. But the main bit of your conversation, Nick, was about saying, I think, if I paraphrase, we've got volunteers who really care and want to get something, want to assist in a GP practice, because that's the obvious route into supporting carers. And I wonder, in a way, and Kath, perhaps you could come in here, whether the question is, Jane, as a typical practice manager, what's going to make it easy to use these volunteers? I will ask Kath to respond first, and then Jane, because it's almost like, why wouldn't you? But there are reasons why offers aren't taken up, aren't there?
Yeah, and I think there could be a link there in terms of what's already established, and it's just making that connection with new opportunities to link up with existing good practice. But something I would just like to add in about carers registers, and and for us to feel sort of confident in knowing this, every GP practice holds a carers register, and that's part of their, well, I'm sure it's part of a contractual obligation that a GP practice holds a carers register. Now, how effective that carers register is obviously massively variable across the country, but one should be able to go into a care. So, making just a small link here, GP patient online are the electronic online capability now that we can be getting our prescriptions online and booking appointments online and accessing our records online, and we're trying to push that more to particularly for carers, because there's opportunities that a carer can certainly check that they've got their coded as a carer on their patient record. They can be helping to make appointments and sort out repeat prescriptions for people they care for. But there is real opportunity with a carers register, but it also really depends on how the GP practice uses the coding system for that carers register. So I think there's a lot of work to still do with CCGs in supporting GP practices within their CCG about how they are using their carers register, and is it fit for purpose. And Jane's probably a good example of a carers register that is fit for purpose, and how the read codes, which is the coding system that's used, is used effectively to log those carers. And I believe there isn't just a carers code necessarily. I've been working with Gloucestershire CCG recently and seen an audit that they've done, and apparently there are 99 codes to code a carer against, which is clearly bonkers, because it might be useful to identify that a carer is a carer for somebody of a particular age or a particular illness or a particular diagnosis, particularly dementia, or a younger carer. But I'm sure there's something we can work towards with making those carer codes simple and manageable and really effective. And this is all linking in with CQC as well, so that when CQC do go into GP practices, they're more confident in the knowledge of what they should be looking for, and they absolutely should be asking to see a carer's register within that GP practice and having evidence to show that the GP practice is using that carer's register effectively.
I was just going to say there that what's the phrase? Necessary but not sufficient. So it's like saying I've got a telephone book. It doesn't say that I make telephone calls, does it? So having a register is clearly absolutely essential. It's a requirement of probably the PMS contract. But in itself, it's only a stepping stone, isn't it?
Very much.
Jane, can I just ask you put yourself in the sort of driving seat here? If Nick had knocked on your door or said, I want to come along and you welcomed her, but you hadn't done the work you'd already done, how might the conversation have gone in terms of Nick offering support from her organisation? I know you're in different parts of the country. How might that have gone? Well,
I think for me, if the practice manager in GP surgeries, some of them are quite small, and we've got over about nearly 11,000 patients in our surgery, but there's a lot of work to do, and so I'm very aware of the limitation of my time, but I'm quite pragmatic, so I would ask her to link in with one of my receptionists who's leading on it. Now, again, Sue hasn't got an awful lot of time, so we all support each other here, really. But I bite somebody's hand off because I just know how important it is. Because I'm starting that stage. I don't like to use the word carer, actually. I help my Uncle John once a week at the minute. But, I still get phone calls in the middle of the night if he's wandering and I've got to sort him out. So, that type of thing. Interestingly, in my surgery, and I'm part of the PPG, I've never had anything from the surgery to say I'm a carer, although they know I've got my mobile number. I go in and visit and do appointments with him and things like that. So, but again, I have to take annual leave off of my full-time job to be able to do all of that stuff.
Yeah. And
I think some of our carers struggle with getting home visits because they can't necessarily get that person out, or it's quite difficult. So having a list is fab. It's a starter for one, but there's a lot more work to do. And I think that if the voluntary organisations can help and the practice are open to having that assistance with helping them, then, setting up a group. I don't think carers have a lot of time to be attending a meeting just to talk about things. From the information I'm getting back from our carers, they actually want practical help, as the lady has said. They're going out and helping them filling out the forms and making their assessments of the finance. They don't actually know what they can actually claim for half of the time. There's no basic information out there. A little tick list, like I do with my induction with staff, so I make sure I don't miss anything.
That's what our care planners do, Jane. So where the care planner is a little booklet, it's a 26-page booklet, which is just some bare bones information. Have you thought about this? You might want to think about that. And in the back, it's somewhere for somebody just to keep a record or a note, so key dates, appointments, where they've been to see what agencies, who they spoke to, what the number was, just a reminder, really. Hey, Kath's got it. So we provide those.
For people?
Well, yes. I mean, I have to be honest and say this is a sticking point for us because I genuinely didn't naively anticipate the demand. And we've said, we can provide these for free. I've now printed 3,000. Kath was the very first person that I showed it to. So that was 2 months ago, a month or so ago. And we've done just over 3,000. And now the hospitals are starting to say, can we have those? And I'm thinking, oh my God, I've got no money for this. So we actually don't have a huge budget for the My Care planners. We can to a point, but we do need to look at how we're going to resource, any more.
Yeah, have you got something attached on your website so that if people want a printed version, they can click on this link and print it out themselves?
Yeah, they can. I mean, they can go to Care Navigators and they can request a care planner as individuals. That's no problem at all. What I'd love to do is have a much wider reach so that we were able to go to GPs, we'd be able to go to the hospitals and say, do you want to use these care planners? Because we do have navigators and partners all over, not all over the country, but it's starting to grow and more quickly than I'd ever envisaged. So we will have, people in different areas. Bath, no, we've got somebody in just south of Bristol, so probably too far for you. But so the one at a time is fine. But for example, Which we've just sent 300 to Which, so it's that's difficult. And they could download them and print them off, I'm sure. But
so it's about the money, and I think that
if we look at the money, isn't it?
But interesting, if you look at how much the carers save by keeping these people out of hospital, it should be funded. The support at home should be funded properly, and with all the paperwork behind it, so that you can keep people at home, because admission into hospital is very, very expensive.
So tell me, Jane, just to come back to your kind of role as extraordinary practice manager, not average. But if Nick were to, as it were, knock on the door of another practice, but you happen to be there, kind of how would you? What advice would you give to Nick around being persuasive, I suppose? And that we can talk about what appeals to people. Appealing to individuals' consciences and the legalities of care support is one thing, but also to a busy practice manager or lead GP. What do you think? What approach might work best for Nick, do you think?
I think for GP surgery, the approach has to be, how can you reduce your admissions into hospital? And by supporting your carers, that's the key. And then you're offering a free service to help them with their carers list, to support some of the staff if they have an interest, because I've got 2 other carers in my staff of 25 who help and support their relatives. So so it's one of those things. And if you are looking at all of the sequence that they put through the NHS and the contracts and things, and it comes through nationally, and there's something attached to some financials, then somebody's going to say, oh my God, this is going to be free. That'll be fabulous, because that will save me some time.
And do you think we've got 2 professions, if you like, on the call, plus Kath and myself, but if we had a provider, and I worked recently with Bristol Community Health, which is what it says, Community Health, and I'd be wondering, is there any interest from those kind of providers for support for carers from an organisation like yours, Nick?
We haven't approached the domiciliary care providers, but we've had 2 come to us in the last couple of weeks saying, can we have? One of them wanted 500 copies of the care planner. And of course the answer is no. I'm really sorry, but we just can't do that. And it would be fantastic if we could. And they will be leaving care planners with not just with their clients, with their patients, but with their loved ones. So the care planner is for everyone. So we don't want to be too definitive over it. We're not going to be too restrictive over it. It's for carers, it's for families, because we're interacting 80% plus of the time with carers and family members, aren't we? I genuinely I didn't see the demand for these care planners coming.
I was just picking up on Jane's point there. Bristol Community Health, as an example, is an NHS provider rather than a domiciliary care. And they will have sequins, as they're called, around reduced admissions for older people. Bound to. Absolutely, definitely. So whilst you might become the victim of your own success by needing to print thousands and thousands of copies, that does fit in with what Jane was saying. a reason why GP surgery can be interested in carer support is reducing the admissions of the frail elderly in particular, but also community health providers will do as well. I think.
Yeah,
I think
more so a stronger interest than I suggest than a hospital would have generally.
I think, Martin, that I worked for North Somerset Community Partnership as a governance evaluation manager before this job, and I think the district nursing teams would bite the hand off to be able to help by giving that brochure across to help someone. Yes.
So again, we're kind of creating demand for something you may not have the capacity to manage, Nick. But
I mean, we would certainly develop resources for, if you like, extending the network or the actual hands-on care navigator providers, the service, if you like, from whatever profession they come from. That actually is quite scalable. The issue that we have at the moment is we don't have a problem with if you like, selling the My Care planners. It's actually meeting that demand financially because they're colour and they're sort of £1.80 each to print, to have printed. So I thought a couple of thousand would do it initially, and that's clearly not going to be the case. So before I know it, we could be running into thousands and thousands of pounds of printing costs that we just don't have resources for. So.
Like you have to balance your demand and your capacity there.
Absolutely. But I do think that if we utilise the partners that we've got at the moment and they're approaching their GP surgeries, it will be very helpful for them to have an approach, a uniform approach, consistent approach to how they can help GPs develop their carer register to be more effective. To do the job rather than just hold a list of people that might be carers.
That's what we were saying earlier, isn't
it?
It's more than a
I'm
list,
really sorry, I'm going to have to go.
I was going to say, Jane, I knew you had to. I was just make sure you weren't late.
I'm happy to be involved, and help as much as possible.
Yeah, thank you.
Thank you, Jane.
Thank you for the contribution, Jane. Yeah, just go up to the top corner of your screen under File. It says Leave the Meeting.
Okay, thank you.
So thank you, Jane.
Thanks.
Are you okay? And that leaves three of us. Nick, would you like to continue in any way, particularly perhaps with Kath? Any further conversation?
No, it's really helpful actually for it to be somebody who manages a GP practice, given our experience yesterday, because she was the lady that was the practice manager was really open and really, she would have been grateful for any help. So any kind of resources that would enable us to have a consistent approach to how we could help, partners can help GPs and practice managers to develop and maintain a useful register of carers. To actually support them, because we could, they would actually be able to man those meetings and organise those meetings, save the time. But it's, we can utilise the care planners. We just need to, come, to find out a way of resourcing that, really.
Yeah, and I liked your idea when you did your introduction about the idea of, I think it was used, Nick talked about a process map. Did you use that phrase? I think,
we need a process for the carers.
How to set it all up, whatever it is. In a GP practice in particular.
Certainly. If their obligation is to hold a carer's register, they're going to have a list of people, and it may be just exactly that. And this manager had, like Jane, gone into a new practice and said, right, well, we've got this list. What are we doing with it? And the response was nothing.
Yeah,
we're not doing anything with it.
She brought her own personal kind of values into it as well, as she happens to be a carer. Kath, did you want to add anything? Or?
Yeah, there's just a couple of things, if I may. Nick, I think what we've got an opportunity to do is to look at those care advisors, your organisation and your funding streams. And I guess what you've got the opportunities is that do you get some CCG funding at the moment to run as an organisation?
No. No, we don't get any. We don't get any local authority or CCG funding. We're wholly funded by our members at the moment, and that's restrictive, obviously. We don't get any CCG or local authority funding.
Because I think for me there's just something about evidence-based that what the organisation is offering and providing is quite key in the whole carers agenda. And I don't know, there's something about putting a little bit of a business case out here that's saying the resources that you have developed through the opportunities that you can do through your members, but actually it's about getting a bit of sign-up from health and social care, because it would be so small but make a really big difference. And I will look at, from an NHS England point of view, if there is anything we could do to support a printing cost, or to just enable, in terms of the carers budget that we have, because there's something about if you've got that evidence base to show that the resources that you're putting out there are having a positive impact from the people receiving those resources, and we can put some measure in place that can possibly show how that's improving quality of life for patients and ultimately carers in terms of accessing the right. I mean, it's a very difficult thing to measure, probably, in terms of how can we evidence that they have saved thousands of pounds or they have access.
I was a little part of a whole national project that just made the brave assumption that community matrons would save admissions, and then 2 years later, a university proved that maybe they didn't, but we'd done it by then. And all the community matrons said, "I did. It did."
It did make a difference.
Forget the university.
We can't do your hard outcome. We can do literally £sign benefit entitlement. We can show the CHC entitlement. We can show the case studies. We can give examples, if you like, of. The screen's just gone blank. But we can give examples of people that have been helped and how they've been helped, whether that's, resourcing, funding information for their care, making sure that they've chosen affordable care throughout their lifetime. They're not coming back to the local authority. We can demonstrate that quite clearly. The use of the My Care Planner, obviously, it's at this point in time, it's fairly early days. And Kath and I had talked about Oxfordshire. Well, I spoke to the discharge team at the John Ratcliffe a couple of weeks ago, went into their meeting, and I took literally 20 or 30 copies of the care planner to say, have a look at this, and they just grabbed them off the middle of the table. Oh my God! And the next day, I had emails from 3 of the different older people wards saying, "Can we have a supply?"
Okay, so there needs a plan, Nick, because you're going to be stripped of all your resource, but in a positive way, and it seems to be able to move forward with this, we do need some creative thinking of a sort of a plan on a page that sets out the demand and supply of this, that with the benefits. Yeah. I mean, I can certainly sort of put something like that with specifically around the usefulness of the My Care Planner and the feedback that we've had so far, albeit, only 2 months into the use of the My Care Planner, and I'm very mindful of going out and making appointments with hospitals and promoting the My Care Planner, because we literally we don't have the money to print thousands and thousands and thousands of them. We can build the service as demand builds. It's certainly scalable, and that actually wouldn't be a problem, because that's delivered by independent partners. And as you know, we insist that they've reached a standard before they can become partners. So that's not the problem. I can certainly put something sort of together, cobble something together that would suggest the usefulness of the resource itself, the planner itself. That would be incredibly helpful. Well, I think, but also, is there an option that this resource could come at a minimal cost to provide organisations? because, I mean, it's all economies of scale, isn't it? The more you print, the cheaper it is. And the bottom line is, if a hospital wants to order 500 from you and you've been able to do a print order of 20,000, then that order to the hospital is going to be pretty minimal compared to what it would be if they had to go
absolutely.
elsewhere.
Yeah,
I wonder
absolutely.
if trying to find you a bit of a front-loaded small amount of money that could get you another print run, but then you're in a position to be able to say, we will be making a minimal charge of X per copy to cover costs, but still a very cheap resource for health and social care. I don't know what do you think of that?
Yeah, absolutely. I think you're right in that it will afford me the luxury of being able to approach more GPs or partners to approach GPs, local authorities, clinical commissioning group, hospitals actually, rather than the groups themselves, to say, are these going to be useful? We'll be able to issue you X up front at no cost. And individuals can have them at no cost. That way I would always want the individual carers and patients to have one themselves for their own personal use for free. But in an ongoing way, if once you've used your first batch of however many, 2, 3, 4, 500, then there would be a small cost to just literally to cover the printing for the replacement stock. Yeah. That seems fair, doesn't it? Because at that point they will have, hopefully realised that they're useful.
Absolutely, and you've got to, you want to survive through all of this.
Yes.
Quite.
So we've just got a couple of minutes left. Is there anything concluding or action focused? I know there's only the three of us on the call, but
I mean, if I put something together with regards to a process map for what I would see GP practice managers find useful for my partners to go in and say, this is how we can help with you utilising your carers register most effectively in an ongoing way. Would that be useful, like a PowerPoint or a PDF or something? Would you look that over for me?
I would, because I do have a slight health warning. I think with how I think there's absolute value and there's clearly there's opportunity here. I guess it's understanding that the GP practice environment. Well, it's just unique and individual with every GP practice because, as Jane mentioned at the beginning, every GP practice is a business, and there is and it almost has its own culture, its own leadership, its own way of working, and it's about getting in through the door in an inclusive and enabling way, rather than the GP practice thinking, well, we're doing fine, thank you. Do you know what I mean? It's a sensitive area, primary care.
Yes.
And I think it would be really wise to use the language of primary care when looking at how the network and partners within the network can enable carers to be better identified and to be accessing all the right things. And it is about recognising that the network would be working with the PPG potentially, because that's the resource that primary care does have. Every GP practice has a patient participation group. How effective they are is again very variable, but there's possibly some relationship building here between the network and the PPG, where carers are, with this one area of carers.
Yeah,
well,
absolutely.
Can I interrupt there as well? Just because we do need to close in a moment. We had Jane on the line. There are other practice managers of her kind of persuasion, who've worked hard already. I would suggest, Nick, that co-writing something, not even just checking it out, but co-writing it with a practice manager will give you the highest chance of having something that is in the right language, pushes the right buttons, to use a bit of jargon.
Okay.
That is about their agenda, not yours. That's the way to communicate, isn't it? Is to put yourself in their shoes, and that's not always the carer's shoes. I have to say, it's the practice's shoes.
Yeah.
To be blunt.
Yeah. Okay.
But that might be a.
Okay.
That might be
so
way
literally
forward,
go along with a kind of a bullet point sort of list and say, would you would you like to work together on moving forward with a supported carers group for your meeting up with the patient participation
and then do some learning from, in other words, if you were to produce, if the end result was a handy little tool that you and other people could use in a practice, the process for coming up with that handy tool must be to work with a like-minded person like Jane.
Yeah.
You see what I mean? So I would suggest don't go away in your room and write it and then check it out. Actually write it together with somebody who's already on your side.
Yeah, with regards to the carer support group. I mean, we can certainly approach the GPs with the My Care planners, but it would be more, what I'd like the partners to be able to do is to be much more proactive with regards to helping the GP surgeries run the carer support groups more regularly, so there's much more.
And as we've been saying, the end point isn't to have a group. The end point is to support carers. So just have that in mind. That some people might say, well, a group won't work. We're too rural or something. But
we can use technology, can't we?
Yeah. And if you stick in there and say, well, actually, okay, the group isn't necessarily the purpose. It's not the end point, rather.
Yeah.
They'll probably listen. But to co-write it with a friendly GP or practice manager, more likely.
Yes.
Sounds like you could have a tool that could be used elsewhere then.
Yeah. Well, the trouble is it'll be so different, won't it? But yeah, absolutely, it's a valid point. That's I was hoping for a more consistent approach, but it's, as you say, it's the nature of the beast, isn't it? That it will always take swoops and swirls along the way.
Yeah, but knowing the right people to talk to and so on is helpful. We ought to close. Let me know, there's only 3 of us here, but let me know, Nick, if there's anything you'd like us to put on the Patient Voice South website. Certainly we could put the plan on as an example. But you've got your own website, I guess, have you?
Yes, it's the carenavigators.co.uk website, which is where individuals can request a care planner, the My Care planner.
Yes, okay, well, I'll make a little note about that and we'll put it in put it next time we put some more information on our website.
There's bits and pieces of information actually on the website, but there's so much information out there, isn't there?
Yeah.
So much valuable
But it'd be nice to reference what you yourself have done. And Kath, last word from you. Anything about the linking in with the 50, 60, 100 people, however many it was, who've been to or will have been to the events? And then, in other words, Nick isn't on her own. Neither is Jane.
Well, no, no, totally not. And I need to think through how to weave this back out to the people that attended, because I think there's the starting of something really interesting, which could be for the benefit of everybody.